Hello everyone, so it's May 14th, 2022. I will be taking my Step 3 examination in approximately 1 month from now. So I started off making this CCS case mini-series for Step 3 a couple days ago. I've done like 3 cases so far, and I guess I already have a general understanding of what these CCS cases are. So before me doing the fourth case, which is actually from the USMLE practice materials, what I thought of I should do is a brief video explaining what the CCS cases are and who might benefit from seeing these mini-series CCS videos. So, in general, I believe that anyone who has a passion for medicine, who is training in the medical field, might benefit from seeing this mini-series, and the ones who will benefit the most will be anyone who is preparing for or who has step 3 still pending. Okay, so what does CCS stand for? It stands for a clinical case scenario. So, in general, in any medical examination, you usually have this multiple choice questions, and you will also see this throughout the step exams, but this is an option for us being evaluated on more abstract skills and how we are trying to interpret everything as a whole. So this is I believe so far I've had a great experience doing these CCS cases. The practice questions I've done so far don't seem very tough. They aren't that challenging, but I must say that I graduated medicine approximately almost a decade ago. So I've already worked in several different emergency departments and different places where I've seen many of these cases over and over again. And I also have some residency experience of my own abroad, the US. So maybe that's the reason I'm approaching these cases actually in a positive and enjoyable manner instead of just stressing out and yes, staying like paralyzed. But I believe that in general it's a good addition to the exam. It's a sort of relaxation doing these cases because when you're doing uh, question after question and these multiple choice paragraphs, huge paragraphs, um, which would be step 1, you will understand that having these questions actually gives you like a breath of fresh air, right? So yeah, so these CCS cases, here is the introduction. So first of all, go into usmle.org, and what you could do is type in step 3 CCS cases, enter that, and here you can see usmle.org, and it will give you the introduction about them. This video is pretty good. I recommend you seeing this video. It's 14 minutes long. It's definitely worth it. You can speed it up right here if you don't have that time. Start off seeing this after this introductory video, but in general, so they will present you with, I'll show you, give you a short glimpse of it. So if we search a practice question, I've already done some, let's see, case interface. No, let's better see it, how it works in general. So step 3 CCS case, um, practice case you'll see that this will pop up. Go to the, okay, it brought us to the exact same place we are at. So let's get to this a different way. Step exam, step 3 maybe. After that, choose not this. Step exams practice, prepare. Step 3, materials. Go to test questions, sample questions, and then go to the bottom part where it says Step 3, interactive testing experience. And it will take you to the different types of questions you'll encounter in Step 3. So take into account that you will have different types of questions. The usual multiple choice question, it will be here, but the new addition are these CCS cases. So here is a CCS tutorial. I'll just show you briefly what this is about. Let's jump through what isn't that important. So we already know this in general from the STEP exams, how to use this toolbar. So here you can choose how large or small the font is. Here you can reverse color, whichever you prefer. Calculator notes, lab values. I won't be talking about that because you might have done that in Step 1, 2, or you should have already managed to know this for those steps. And if this is the first time you're seeing this, probably you haven't taken the steps, but who cares? Just ignore that toolbar. It won't be important for seeing these videos. So simulated time, this is very important. So you will have real time. It says that you will have 20 minutes per case approximately, and simulated time will be totally different. So it's a simulation, it's a game. So depending on how you advance the clock, you will manage time correctly or not. So depending on the case, a couple days could have passed or a couple hours could have passed, but in general the real time you have for each case will be exactly the same. So that's something you have to take into account. Here you have 10-minute case, 20-minute case. Okay, so this is the real-time case you will have. I'm not sure if you'll have some cases longer than others. I thought they were like 15 minutes long, but in general, you'll have the clock right. Initially, we'll tell you how much real time you'll have, and you'll also see the clock around there showing you the time left. Then, okay, see, right here you will see the simulated time. So this is the window that will pop up and will show you the options you have in order to manage this patient. So 1, 2, 3, and 4 boxes. One is interval history or physical examination. Basically, whenever you want to assess the patient again, you'll click on this one. If you want to write orders, that is, ask for more diagnostic tests, be it blood work, imaging, or if you want to start the patient on therapeutics, or if you want to send the patient be in telemetry or have telemetry done. All these orders are right here. If you want to cancel a medication you already gave the patient, it's right here. In the clock, it's once you chose this one, or we'll jump to this other one. Once you already chose what you wanted, you will have to advance your clock, because if you don't advance the clock, it's as if you were frozen in time and you won't be able to see any of the effects of what you just did. So this right here is choosing the allocation of where your patient is. So it could be that your patient is it depends on, you have to always see it. You might be in the office, you might be in the emergency department. You will know where you are seeing the patient once the case starts, and you just have to see this box. If the patient is in the office and you already finished with the patient with a simple non-complicated urinary tract infection, you should send the patient home and then give an appointment to the patient. If your patient is unstable, if you have the patient in the office, you have to send them to the ED department. So basically all of the different actions you will take will add some time to your simulated time, okay? The only action that won't change time or advance the clock whatsoever is the last box. That's the way this game works. You can change the patient's location from ED to the office or to the ICU, and no time will have passed in this simulated time, just so you know. And right here you have the elapsed simulated case time. Okay, so bottom left, you'll know how many days, how many hours have passed in the simulated time. Right here, case end. This is very important. So that if a case ends, it doesn't necessarily mean that you did everything correctly or incorrectly. So if you're doing everything pretty well, the case might end earlier. If you just clicked on advance the clock and you didn't do anything at all, the case will also end. The most important part is how you deal with the process, not necessarily the diagnosis of the patient. It's more important the process of the actions you undertake. Okay, so before the case ends, you'll usually receive this right here that will tell you that the case will end in 2 minutes. It will be 2 minutes of real time, and here you should finish or wrap off the things you might be missing. So what you can do is write new orders, cancel pending orders, review chart results on the chart, and exit the case. So when you see this, go back and see the summary of what you did, if you're missing or not missing anything. If you're not missing anything, just click on exit case. And on the case, what you won't be able to do is advanced simulated time, see pending results, order physical examination, or change locations. Okay, so let's proceed to the next item. So initially you will be given 3 screens. So screen number 1 is case introduction. This is basically saying chief complaint. So it's the one-liner or 2 sentences tops of why the patient is coming. After you click next on that first window, you can't do anything because in real life you shouldn't start managing a patient without knowing the patient's chief complaint, vital signs to know if they're stable or unstable, and history of presenting illness. So you have to know those 3 things before you decide to act upon it. After that, you'll have your toolbar. So there you go. You can choose whichever you want. You can choose to, usually in most patients which are stable, you will usually ask for the physical exam, and it will give you the options of if you want head, ear, nose, throat, or if you want chest, or if you want all of these assessed. If the patient is unstable, the patient has chest pain and is unstable, you'll probably go first with the EKG. So you have to know how to use your time, and there's where your clinical knowledge will be manifested. Okay, so proceed to next, interval history or physical examination. So here you can choose any of interval history or physical, and these are the options I was giving you right there. And after that, you can also write orders, and you have to click on order, and another page will open, which is this one right here, and here you can choose what you want to ask for. So the first 3 letters might be recognized by the software. So if you're not sure about something, you can write just 3 letters. For example, telemetry, you don't remember if it ends in a Y or an I, for example. So just write down the first letters and click on confirm order, or actually ask for everything you want. Write down the list. So write X-ray, press enter, write telemetry, press enter, because if you do it all in one line, it won't understand what you're asking for. So for each thing you're asking for, press enter. It doesn't have to be in any specific order. It doesn't have to look nice. It's not like first when you learn this in medicine, and when you actually write it out, you use a specific order for your mental framework. Here it doesn't have to be any particular order. Just each thing you ask has to be in one line. Then press on confirm orders, and it will take you to another page. And this page, it doesn't show it right here, but the page it will take you to will ask you what do you want. So it will show you the x-ray, and it will show you a whole list of x-rays. Do you want a portable x-ray, or do you want posterior anterior x-ray of the chest, of the abdomen, where? Click on it and press OK, and then it will take you to telemetry. You just wrote down the first letters, then you'll see all the available orders with those first letters. So if you want to save time, try to do this the quickest possible. For example, there are certain acronyms such as complete blood count. You can write down CBC. For basic metabolic profile, or you can write down BMP, and it will appear right here. That's why it's important for you to practice these questions, so your clinical knowledge isn't limited by the software and the intricacies of this game. So once you have all the different orders in, just here you have the list. Just proceed, and you will have to advance the clock in order to see the results. Pre-existing orders or canceling orders. Okay, so yeah, you can cancel orders, and I guess it doesn't show it right here, but you have to go once again into orders, and you have to click on this. For example, you click on here, intravenous line, click on it, and it will tell you, do you want to cancel? Yes, no, or yeah, suspend it maybe. Okay, so let's move on. Other tabs in the chart. So here you have, okay, here you can see what's going on. Here you can see vital signs, lab reports, imaging. So as you advance the clock, you will start seeing these reports, and you have to click OK. But if you forgot something, if you want to see how the patient has progressed, you might have to come back to these, click on these, and see how the vital signs trends have been, for example. Then you have, this is important, if you don't move the clock, you won't get anything done in this game. So this is what happened to me in my first try. For example, I started writing orders and then didn't know what to do. And it's important that you know that you have to advance the clock. What would I recommend? Start off playing this game with advance it to the next available result, because that's what makes sense, and that's like the safe way to go. Probably you'll have to click on this several times so you can see several different exams, but it's the safe way to go initially. After you get confident with the game, you can choose prolonging this a little more. So if you know that all your exams will be due in 30 minutes from now and your patient is stable, choose to see the patient in 30 minutes, for example. Okay, so simulated time options, reevaluate screen. Yeah, we already talked about this. You'll practice it and see how it works. You can use any of these different functions. If you sent the patient home and there's nothing else you want to add, and the patient is doing fine, and you're calm and you're satisfied with your approach, mark this one, call see me as needed, and click OK on it, and they'll tell you how the patient is doing in 2 weeks or something. Change the patient location. We already saw this right here. So there's only 4 places you can choose from. There's no other place, so deal with it. If you want to send the patient to the surgical ICU, well, choose intensive care unit, and that's it. You don't have to specify. You have the ED, ICU, inpatient unit, office, home. So this depends on what your patient has, basically. So complicated urinary tract infection, you have done everything already for the patient, and he or she has to fulfill 4 more days of IV therapy. Send them to the inpatient unit. You don't want to send them home, probably. Yeah. So other instructions. Okay, 6 sample cases. I guess there are 6 different practice questions. I already did 3 of them in this mini series. I'm gonna complete all of them, and these videos will be in one list that will be named CCS case series, and I'll place this one on top, although I'm recording it after I already practiced with a couple. As I advance and evolve and find out tips for you guys, I'll be sharing it. Please, yeah, give me any feedback to see how we can improve this game. So, okay, timed or untimed. This is just telling you how do you want to practice. I would recommend the first case or 2 cases, do them on time, take the whole time all the time in the world to go through it. And once you already understand a little the game, you have to practice in the same scenario you're gonna be tested on. So after that, go on time, and that's it. See you in the next one.